Being a resident is hard. Too many tasks and not enough time. And gaps in your knowledge can feel overwhelming, unless you have the right resource at your fingertips. I'm David. I'm a physician author at AMBOSS. My team and I, we use our real-world clinical experience to condense guidelines, textbooks, and the newest research into concise, actionable information that's ready for you to use at the bedside. We all know that caring for patients with cancer is intimidating. We learn the pathophysiology of colorectal cancer, but not how to prep a patient for chemotherapy or how to deal with complications at 3 a.m. So when I wrote this article, I tried to focus on what I would have wanted to know on call. Clear steps to guide me through conditions I wasn't familiar with, giving me enough background to explain to patients what was going on while not getting drowned in details. Now imagine that you're paged to evaluate new onset tachycardia. You learned in med school that the first step is to triage stable versus unstable. And if it's AFib, which it usually is, you know what to do. But if it's narrow and not AFib, that's where AMBOSS helps you step back and consider what the next steps are. Whether that's a quick refresher on vagal maneuvers, or guideline-based dosing and easy access to contraindications. So this is the platform we've created at AMBOSS, and we're constantly innovating and expanding our content to make it the best resource for residents. Check out AMBOSS today.